Hi guys, it's Michelle. I decided for Christmas we're going to do my cranial courses. I have 2 cranial courses so far. I have my series, Head and Sutures and Nasal and Ear. And just in the Head and Suture course alone, there's over 182 videos. Working with cranial movements is important because all of your developmental milestones come from cranials. And by the way, the course, 3-week access, $200. So you're not going to get that anywhere, and it's a perfect opportunity to get it. The head, when you're born, this is an infant skulls, has many different suture points and facial bones, head bones, that all come together, right? We think as the head starts to fuse, and this is a 6-year-old, right? But the buds coming in, the teeth. We think that the head is a solid object, right? Which it is, but at the same time, did you realize that all your developmental movement milestones need to happen before the skull fuses? We think of the soft spot, the anterior and posterior fontanelles, or your soft spots, closing, and that's what we're here. But I bet you most of you didn't even realize that like here, the metopic suture, the frontal suture comes in, the frontal bone. Our forehead is actually 2 bones. Yes, it's to get out of the vaginal canal, but it's also for all your developmental movements, right? The skull starts to fuse around 9 months and continues till about 18 months. It's not completely fused till you're about 20, but all of these developmental milestones, like did you know coming to sitting happens because of the rocking of the temporal bone, right? And so a lot of our munchkins have had, let's say, cannulation goes around. Look at how many bones just cannulation goes into. Forget the inside of the nasal bones, but comes around, goes over your maxillaries, your zygomatic march, your temporal bones, mastoids coming around, hitting your mandible and into your hyoid bone. There's a lot that goes on in the human body, and there's a lot that goes on to save your baby's lives. A lot of people have had some form of brain trauma. That's mostly what we think about, but we don't realize that brain cooling, cannulation, intubation, I can go on and on. My son's case, infection, can affect and will affect not only facial movements, but your developmental milestones. Just having your eye access is off and so forth. Flat head is now in 65% of all babies. It affects development. We're meant to have a certain cranial, not only positioning, but movements. And that's what's covered in the course. The other course is probably my biggest passion, is the nasal and ears. Right, you're going to be getting into all the sinuses that's going into the whole inside of your face. Even again though, intubation, CVI. Did you know a lot of people with CVI, a lot of munchkins, have a frontal lobe that is offline, putting stress on your ethmoid sinuses, sphenoid sinuses, and by the way, your eyeballs fit in between that. And that's one of the reasons why CVI goes in and out of functioning and focus. This isn't just for pediatrics. This is for adults. You will be learning functional anatomy, right? Yes, it's nice to know that this is your frontal lobe, let's say, or your maxillaries, but you will be taught how this affects your development. I can't even begin to tell you how much that this is really a part of your program. It is $200. These are advanced techniques, and the reason I say it's advanced technique, again, the course is about 182 videos. Now, not included in the course, though, at this price are the books or the media that comes with it. That would have to be where you'd want the course in your library. But I've taken many courses, including cranial sacral level 1 and 2. I get 2 days of training and get sent home. I do have to buy the books. No videos, no memory. I have to rely on my memory. This is part of the reasons why I do all the videos that I do. I'm a visual person. I need to see it. I need to review it. I need to go over it. So I can't stress enough that this is my Christmas present to you. This is where I want you to be a part of it. Movement Lesson when I say it's advanced, like I said, this isn't something that you pick 3 videos out of it and that's what you're doing with your child. You know, I want you to go through it step by step, but again, it'll be a 3-week access into my private Facebook course as well, that you can get in on that and to learn and work with me on a daily basis, where if you have any questions, and posting your videos. I can't even stress enough, again, how much of a value this is. And for those of you, again, at the professional level, and doing other modalities like cranial sacral. Cranial sacral, working on the cranial pulses and working with that is wonderful. But you're relying on the body's inner physicians. And in some cases, again, the cranial movements haven't set up to create those developmental patterns. And that's beyond your physician. This is your movement coach, right? And that's what I am to you. So please, look at all this that goes in. Now, this will be more of my palette course that definitely I thought I'd have done by this year, but it'll be into 2022. Look at what happens just in the buds alone. If your child's had intubation and now their alignment of the jaw's off, this is where a lot of children with CP might have great teeth or alignment underage, but when their adult teeth comes in, you get into that overcrowding and what's going on. And you'll get a little bit of sneak peeks going into the palette course. I know it's short notice. I know it's right before Christmas. The course is going to start December 29th. The 2 courses are separate, the nasal and ear and the head and the sutures. Feel free to post your questions if you feel that you can only do 1 course, and which one should you take depending on your child. Again, I'd love to see a video and work with that. But it's your opportunity to get into cranial movements that you've never seen before. Those of you, especially too, that have done the cognitive vision and you realize how much facial movements and alignment goes into your eyes, your peripheral visions. I just had a Zoom yesterday with a child, and I can totally tell, even just the way that the spine is not crossing midline, right? Again, that the movements around the face. So even though the child was moving around, this is not a midline crossing. Things that you'll be learning in the cranial courses versus here. Tummy time is really important. Why? Because we have one straight line in the human body, and that's our nasal septum or our vomer, right? And just that movement of that vomer, right? That's what tummy time is so important. It sets up so many movements, including your infant reflex patternings. So when that doesn't set up your cranial movements, I'm telling you right now, when there's issues there, traumatized, head development, you will see that in what you're looking at for, quote, movement and reflexes, because this is how your articulation of the head, coming out of the vaginal delivery, the parietal bones coming out are actually your first movements, your developmental movement patterns that happens within the skull region, but into your body and sets up your spinal column. A lot of kiddos have had just C-sections, and people don't understand where I didn't have any medical trauma. I just had a C-section. But if your child was taken out foot first, right, instead of the cranial movement setting up, your child is at a higher risk for developmental movements. Please, I can't stress enough that this is the course that you need to take. Again, it's $200. It's set up in different currencies. Now, by the way, too, guys, if you ever need any of my courses in a currency that suits for you, not that I can do every currency, but PayPal or Stripe does allow me to change that around. I can set it up for you. It's not set up because currencies change. There are 4 currencies set up, but at the same time, please, this is a really a lifetime opportunity. It is of just short notice, and because, again, it's just a great opportunity because there's a couple of people, you even just see a post that just happened where a child fell and threw off her cranial movements. It's really important that I'm helping you, but it's more important that you take advantage of the courses. So please, join me. I start December 29th, but again, it's $200. You get 3-week access to all the videos. And there's a head and a suture course, and then there's a nasal in the ear. if you're a type A personality, you can pull off both in 3 weeks. That's another reason for doing 3 weeks. But by all means, probably your best bet is to start with the head and the sutures, because you'll get the whole outside of the cranial movements before we go into the ethmoid. But you really hear me all the time. Here's the front of your face. There's your ethmoid. Goes into your nasal cavity. A lot of munchkins, especially NG tube, intubations, all of that have an ethmoid jam, and that's what it looks like. So if I'm looking at you like this, now I'm going to jam up my ethmoid, right? This is where a lot of children have visual issues. See, I can't see you. Just because of my ethmoid jam, way it just spreads my brow just a bit. And this is where you get confused. My eyes are coming back now. Because you're told by your ophthalmologist the eyes are fine. They are fine. They're structurally fine, but your child still has issues with vision. And this is, again, an opportunity of a lifetime to really get into a lot of these things. I really hope that you join me. But most of all, again, I'm calling it Christmas because that's what I celebrate. But by all means, I hope you had a great Hanukkah, Kwanzaa, for all that your celebrations that you might do, but just to be with your family. But this hopefully is another opportunity for you to help your family. Thanks.